Hello, welcome to 10 questions and 10 answers about your health problems. Today, I will answer 10 questions about spinal tumors. As you know, spine is our backbone and very important structure and include vital tissues like spinal cord. And spinal column, together with the spinal cord, is an important combined organ for our functions. First question about the spinal tumors will be, what is a spinal tumor? A spinal tumor is a growth of cells or mass in or surrounding the spinal cord. Tumors in the spinal column may cause back pain from expansion of the bone or from weakening of the bone, which in turn can result in spinal fractures, compression or pinching of the nerves or spinal instability. What are the reasons of the spinal tumor? The most common cause is metastasis of tumors from the other organs. The metastasis means a kind of tumor that will spread or that is caused by spreading cancer. The most common metastases or spreading cancers are as follows: prostate cancer in males, breast cancer in female, lung cancer in both gender, and also thyroid cancer in both gender. There can be also primary tumors. Tumors that start in spinal tissue are called primary spinal tumors. For example, hemangioma is the most common primary tumor in the spinal column. This is a kind of benign condition and it's generally asymptomatic. And we don't need actually do any intervention for this benign condition. Most of the studies, autopsy studies show that almost 90% of the population have a hemangioma. So, if your MRI report resulted with the hemangiomas vertebra, please don't panic. This is a common benign condition. Multiple myeloma is the most common primary malign condition of the spinal column. And generally, this needs a kind of radiotherapy in patients and sometimes needs surgical treatment as well. Other primary malignant tumors are osteosarcoma and Ewing sarcoma, which are rarely seen within the population. My third question will be, what are the symptoms of spinal tumors? The most important symptom is the pain at night. Metastatic, especially metastatic tumors, usually produce pain that does not get better with the rest. It may be worse at night, and it is generally often accompanied by other signs of serious illness, like weight loss, fever, chills, shakes, nausea, or vomiting. Another important symptom is the abnormal gait, which because of the lower limb weakness actually, and sometimes spasticity of the muscles. Loss of sense of the position in space, numbness, weakness, tingling, again, difficulty walking in the dark, also important symptoms for the spinal tumors. General mid-back pain they may have. Another important symptoms, and actually this needs a kind of urgent intervention, is loss of bowel and bladder function. Paralysis in varying degrees, also another symptom of these spinal tumors. Again, scoliosis, we may have seen a kind of structural curvature of the spine because of the spinal tumor. I actually warn you about the important detail. Don't jump to any conclusions based on your symptoms, though. Back pain in particular can have multiple causes and is very common problem across the population, especially non-specific back pain. we are looking for recurrent, persistent, worsening symptoms together with the pain. How can I tell if my back pain is a spinal tumor? Some of the symptoms of a back or neck tumor are similar to other spinal disorders. Keep in mind that a spinal tumor is a rare condition. So don't panic, as I mentioned before. Non-mechanical back or neck pain is most common symptom. This type of pain is constant, is not activity related, and is not relieved while laying down or resting. Other symptoms that may be associated with a tumor include sciatica, progressive numbness or weakness, fever, partial paralysis, or bowel and bladder dysfunction. Of course, as I mentioned before, bowel or bladder dysfunction requires immediate medical attention. My fifth question will be, how can be a spinal tumor diagnosed? If any tumor is found in the spine and there is no other known cancer, a complete examination of all common organs where cancer develops is usually warranted. Evaluation may include, of course, medical history. We need to go down details of the medical history, especially weight loss within let's say 5 or 10 kg, weight loss within 2 or 4 months without any cause. It is very important actually sign of a kind of tumor. Physical examination also important. We need to actually seek for a kind of instability, pain with the motion. These are important symptoms, main important symptoms for the spinal cord and spinal column tumor. Neurological examination is very important since spinal column includes a spinal cord. Radiographic studies of the spine, chest, and gastrointestinal system to screen for tumors, also important too for us. MRI and CT scans, of course, very important to actually search the problems not only within the spinal cord and surrounding spinal column, but also in lung, in liver, and other vital organs. We need to have a biopsy for a pathological diagnosis, which is crucial, and it should be done actually if a spinal column tumor suspected. My sixth question will be, why is the biopsy crucial? Because we don't always need the surgical treatment in spinal tumors, and non-surgical treatment like radiotherapy or chemotherapy can be enough for the treatment sometimes. That's why we need a pathological diagnosis. Seventh question will be, which kind of methods can be used for biopsy? The most common way to perform biopsy is obtaining the sample by using a thick biopsy needle under the C-arm, which is a kind of portable X-ray machine. This can be done under the local anesthesia. Another way is to do it by using a CT scan guidance. And we seldomly do an open biopsy since it causes contamination of healthy tissues with tumor cells and makes the treatment more complicated. So we generally go for a kind of needle biopsy, but this also needs a very high level of expertise in pathological examination. So pathologist is important to give us a diagnosis. Then we can proceed with the treatment after this diagnosis. Eighth question will be, which kind of treatment options are available? First of all, the goals of treatment are increase the life expectancy and prevent nerve damage and of course pathological fracture, and which may caused by pressure and the spinal cord. Treatment should be given as quick as possible after having the biopsy result, and treatments include, if the patient admit with the paralysis, we should give the patient a corticosteroid, and this reduces inflammation and swelling around the spinal cord if the patient has a spinal cord compression. And this kind of patients who admit with the paralysis, we may need also emergency surgery in order to relieve compression on the spinal cord. Some tumors can be completely removed in this stage, but in other cases, part of the tumor may be removed to relieve pressure on the spinal cord. Elective surgery is another option. Of course, we need this for the biopsy. If the patient is a actually resectable tumor, then we need a radical surgery. And this gives a chance for total recovery and prevent recurrences of the patient. Radiation therapy is another option, and this sometimes used instead of the surgery. If the patient have multiple focuses of the pathology, then we may need radiation therapy together with the chemotherapy. If the condition is radio and chemo resistant problem. Chemotherapy is important option and may be recommended, especially depending on the tumor. My ninth question is, if I undergo radiation therapy, will I be radioactive? Most patients who need radiation therapy undergo external radiation therapy, which does not make you radioactive actually. This type of radiation therapy is often provided on an outpatient basis. Sometimes some patients have some kind of side effects like nausea, vomiting, other symptoms, or burning, local burning. So it can be actually easily managed with some kind of medical treatments. My last question will be, is radical operation for a malignant tumor is a risky procedure? My frank answer is, yes, it is. There is risk of that because of bleeding, since the aorta feeds the backbones directly. And during the actually procedure, we need to remove all of the vertebrae sometimes. And some of the actually tumors itself includes many actually blood vessels. So that's why there is a high risk of bleeding. Actually, we generally be prepared for this kind of problems before the surgery, and we actually already be prepared for giving transfusions, the blood transfusion, or sometimes we use some kind of bleeding prevention procedures during our interventions. Other complications may be paralysis or infection or pathological fracture or chronic pain after this kind of operations. And you should actually search for a multidisciplinary and very well established centers for your treatments for the spinal tumors. Stay safe until the next program.